Welcome to the Financial Flossing Podcast with Ross Brannan, guiding dental professionals to a brighter future. Ross Brannan is a financial advisor who knows it's not just about your teeth. He helps dental practice owners protect and maximize today's cash flow to plan for tomorrow's cash needs. Find him at rossbrannan.com. On the show, he brings together experts to help dental professionals looking to make smart money decisions to grow their income, turn their retirement goals into reality, and improve their lives. And now, here's your host, Ross Brannan.
Welcome to the show. Today we have Jeff Gardino. Jeff is the CEO of Bellano Dental and partner with CMG Associates, a four-practice DSO in Memphis, Tennessee. Jeff, welcome to the show.
Thanks so much. Glad to be here.
Well, you have kind of a unique story because what I'm starting to see, I've been seeing for a couple of years, is some people, instead of being bought out by a DSO, they said, well, heck, let me create my own DSO and then sell out to somebody, several years down the road is a much bigger number. Tell us a little bit about your story and how you ended up as a founder in a DSO.
So I started in dental about 12 and a half years ago. Actually, no, it's been like 16 years ago now. And my dad's a dentist. So I was going to be a dentist growing up, started off pre-dental, worked in his practice and loved my dad, would love to work with him again someday. But the idea of working in millimeters was just not my thing. So changed course, actually got a degree in marketing and went to St. Jude Hospital, worked there in marketing, and then converted over to Henry Schein and began a career there and was able to get my MBA during the course of that process and enjoyed my time with Schein. I was there for, like I said, a long time. And as my career went on, I started having customers that I had one in particular who we were trying to help him find a buyer. We tried for 2 years, couldn't find anybody. And he came to me one day, called me in his office, and he had tears in his eyes. And he said, look, I went to the TDA, Tennessee Dental Association meeting. I had my numbers with me. I went to the Heartland booth, showed him my numbers, and on the spot, they bought my practices. He had 2 locations in my buildings. And he apologized to me. And at first I was like, you don't have to do that. You don't do apology necessary. Congrats for you. But his tears were not only really about not being able to work with me anymore. It was also, it really wasn't what he intended. He had this vision of selling to a new young doc coming out. And in a way, he felt like he was selling out to corporate. And the process went fine. And Heartland's a great company. But I then had that happen a few other times. And as I was starting to see these trends in private practice and dental, it became apparent that group dentistry, corporate dentistry is obviously going to become more and more of a player in the dental community. And so I worked with Dr. Wade Clayton and Dr. Drew Mefford, who are good friends of mine. And we got to talking one day, and I had my wheels spinning a little bit about could we do a DSO type model locally, me being a part of it. And they were kind of thinking the same way and wanting a bigger end game. We were all about the same age. And as we got to talking, conversations became more and more serious. Henry Schein at the time had something called the Henry Schein Dental Business Institute, which was a little mini MBA program, a 9-month program for doctors who were interested in kind of a bigger end game. Drew and Wade signed up for it. I went with them. There were multiple sessions. And during the course of that, it became more and more apparent that there was something that we had there that we needed to get going. And so that was in 2016. And so we began to continue the conversations. And then January 2018, pulled the trigger and I made the switch over and I joined running the business side of things. I became a partner. We named our DSO CMG Associates for our 3 last names. And so I'm an equal partner in that. And then I'm CEO of the Bellano Dental, which is just running the business side. And Drew and Wade handle the dental side. And our thing is there's this perception out there that corporate dentistry or group dentistry is bad by some folks. And it's just not. And there's so many advantages to group practices, to group dentistry, to corporate practices, if you do it right. And so Memphis didn't have a local player like this, and we felt like we could fill that niche. Thought we had pretty decent reputations in town, and our goal was not only we wanted to be able to give doctors an opportunity to sell their practice for the fair value that they've been planning to do all these years. But at the same time, work with a local group that was going to keep that integrity and that goodwill that they built with their team and their patients all these years.
So you guys have 4 practices. How many of those were existing practices from the other doctors, and how many of them ones you've already acquired?
So we've done more than 4 deals throughout this. Drew and Wade had a practice, a big practice. They started a de novo in Germantown, which is a suburb of Memphis. I guess about about 4 or 5 years before we got going, and that was starting to build momentum. And then we immediately had a client of mine who I'd worked with for a long time, 2 doctors, and they never enjoyed the business end of things. And so I approached them pretty quickly as once we knew this was going to happen and said, hey, do you guys have an interest in possibly selling and being a part of this? Younger doctors, they're both in their early 50s, and they immediately said yes. So we picked up that practice in East Memphis about 3 months after we launched. And then we did a tuck-in 2020 into that East Memphis office, and we purchased another practice in East Memphis that was in our same complex, and then we expanded our East Memphis office from 6 ops to 11 ops, and we tucked that practice in here last November. So currently we have 8 doctors in 4 physical locations, and then we did another practice in the Cordova-Bartlett area in 2021 as well.
And what does it look like for 2023 acquisition?
Right now, we purchased a new property for our Germantown office. So that little de novo that they started was just a 4-op facility, and our lease is coming up here in September. So we have purchased a new office, and we're beginning the process of gutting that. So we're going to move into that in August. We hope to have a tuck-in, going to be adding to that. It'll give us the opportunity for 10 ops as opposed to 4. And we have a goal of hopefully 1 or 2 more on top of that as well for the end of the year.
And then what's the long-term goal plan? I mean, how many 5 years from now, how many practices do you want to have?
You know what? It's been we don't have a finite plan. We want to do it right. And we've been pretty, some of these folks that get these things going, maybe they're smarter than us or have it all figured out better than we do, but we've been really intentional with our growth and who we want to partner with. And I think the one thing we've learned in these 5 years is that they're who we don't want to be associated with more than who we do. So we're looking for the right mixes. We have a top line goal of the next 5 years to double ourselves and get to that 22 million range per year. And we'll we want to make sure we're covering all the micro markets within the Memphis Metroplex, but to put a definite number on it, we're more about the bottom line and share growth. We've seen definitely that having larger facilities that we can do tuck-ins with smaller practices, that has been a real revelation for us. Not something we really focused on in the beginning, but have seen a lot of opportunity with that in the last couple of years. And I think we'll continue that as well.
One of your partners who owned practices on their own previously said the biggest difference between doing it this way and the old way is?
I think being more intentional. And I think by their own admission, they're scientists, right? So through their mini program with Henry Schein and through the years of doing this, they now are full-fledged. They own businesses and they were businessmen, but now they know business and the idea of EBITDA and returns and handling staff and managing time. I mean, they've become experts in that. So I think it's been really eye-opening just understanding the business of dentistry, which is something they maybe thought they knew at all these years practicing, but now they're rock stars with it. And I think that's the biggest thing.
Is it critical if you do this to hire a standalone CEO like someone like yourself? Because I mean, can a doctor do what they're doing? If can they be practicing and managing the business, or what have you seen?
I don't think effectively by any means. I mean, we've got over 50 employees now, and we've been having me there to be able to really focus on the business side of it. I think we've been able to do some things a lot more efficiently and quickly. They're still at the chair majority of their time, 4 days a week. So we have meetings weekly, at least once a week, if not more. And they are now, we're exploring ways for them to be able to step away from the chair more and more so they can get more involved in in mentoring and training doctors and the clinical teams. But if you really are serious about taking next steps and growing significantly, I don't see how you can do that effectively while spending the majority of time in the chair. I really don't. And I'm very fortunate. We, like I said, my dad's a dentist. He's still practicing. I'd love to work with him. But outside of my dad, these two guys are great guys, and they have a high quality standard of care. And because I can't do this without them. At the same time, I don't think they can do this without me, with my business background but their acumen to be able to point out and find good quality dentists to associate with and know what to look for in that. I mean, not every state requires a dental license to own a dental practice. I wouldn't want to do this without them having their expertise and knowing what it takes to do things right on the clinical side.
And Tennessee does or does not require it?
It does require it.
Does require it.
So, yeah, Drew and Wade own the practices. Mm-hmm.
Right, gotcha.
Yep.
And so what are the biggest challenges on doing this versus, the quote normal model?
Normal model being private practice, or
the normal model being a doc, a one doc operation owns his practice, and that's kind of what.
What's funny is when we started doing this, I guess the most eye-opening piece for us was I'd worked with these guys for a long time, the practices, the staff, and then we made this change, and kind of the expectation was that the old established practice that had worked with Drew and Wade as their dentist forever and had known me forever in my previous role would just all be on board from day one. And they were the most resistant.
Really?
Oh, absolutely. Now, we had some that jumped on board, but it was hard sledding. In my old days, I'd managed people before, and that wasn't new to me. I was excited to be doing that again and growing a team. But dental staff, it's not oftentimes private practices are run fairly loosely. Unfortunately, more often than not, the inmates run the asylum. The doctors do the dentistry. Sometimes there's morning huddles. Sometimes there's a expectation of collection and production goals. A lot of times there's not. And Drew and Wade had run their practice well, and there was an expectation there. But as we became even more, I guess, quote, buttoned up or organized as an organization, we found resistance. And one of the things we have, the Bellano name was new once we launched. And with my marketing background, with the marketing firm we have a great logo, a great look. One of the things we didn't anticipate was in the very beginning, within the first 6 months, once we launched the name, actually within the first 2 months, we had to send a letter out to all our patients that Drew and Wade signed stating that they still owned the practice. It was still a private practice. We didn't quote sell out to a corporate. We had just changed our name and, we're expanding our footprint. And that phrase that a lot of our staff used when they were struggling with the transition was, they're becoming corporate now. And it was like the biggest dirty word in the world. So,
how would they struggle? What would they do? What would they do to kind of so-called undermine things?
Well, when patients would ask a question, some of them would, patients would ask a question of, hey, what's going on? Why the name changed? They would, maybe not necessarily say the most positive things and say, oh, they've gone corporate, or that was what some feedback we got back from patients. They were resistant to the huddle. They were resistant to the logo.
Did you have to let some of them go?
There was, there were some that left for sure. We had to let some go, and we had some that chose to go on their own. There was a level of accountability there that I think it wasn't beyond anything that anyone in a traditional job would have, but things are so lax, and sometimes in the private practice world, that it was just too much for some of them to handle.
That's interesting. It's very interesting. So, are you seeing growth just on patient flow happen a lot more just from a synergies of everything you have going?
Yeah, absolutely. Yeah. Our patient growth has been great. We are very out there in the local community. We encourage our staff, and we try to have relationships with local schools and churches within the little communities our practices are near. We've begun some campaigns in a larger metroplex area that have been positive. When we first started, we really weren't planning to necessarily have a central name. We'd read the reviews. You can go and there's be a giant DSO group, and you could Google the name, and in one city you got all 5-star reviews, and maybe the next town over it's a bunch of 1-star. And we're thinking, do we really want to have one name and maybe let every practice have its own identity? But the more we studied it, knowing that we aren't going to be some mega group, the synergies you can have with one central name, and then the challenges of making sure that we live up to it. That Bellano stands for quality, and Bellano stands for compassion and empathetic care. And so that's kind of how we've pushed it and angled it and what we live up to. And I think it's gone really well for us. I really do.
How your partners who've had practices before, how hard do they say this is compared to what they were doing before?
I think they tell you it's probably, I don't know if it's harder, but it's hard, but they're having more fun at it.
Is it a different hard?
A different hard. Yeah. They're stretching different muscles. We all are, from expanding staff. I mean, we're a small entity. I've got 3 people on my team under me who are working more directly with the practices, and I'm still handling HR and marketing and finance and all that kind of good stuff. So we're still definitely in a growth mode, but it's having a partnership, having the 3 of us. We respect each other. We love working together, and the different mentalities that we each bring to the table, the different mindsets. We've really respected each other's opinions and have been able to play off each other. And I know none of us would want to do it any differently, but it's definitely different than what they were doing before.
Yeah. And a lot different than what you were doing. I mean, when you were obviously a dental rep at Henry Schein.
Right.
I guess the question is, do you still use Henry Schein?
We do. Yeah.
The
guy our new rep is actually one of my best friends since I was born, and he's been with Shine for a long time. So I made sure all my clients were in good hands.
Well, okay, there you go. I guess the question I ask is, I'm of the opinion that if you own a dental practice, you're sitting on a lottery ticket, and a lot of people unfortunately don't realize that. I'm not a big believer in selling to a DSO as an individual really young, like some people are doing. I've got lots of reasons why we won't go to in this conversation. But I guess the thing I'm wondering is, why wouldn't everybody try and do this? Now, obviously not everyone could pull it off, but why wouldn't everybody try and do this?
It's hard. And, I don't, if you're ready, if you want challenges and you want to expand, push yourself, then this is the way to go. And it has been a blast to do it. But if you don't have that mentality and you're not interested in stretching a different muscle and working hard at something that is very different than what you're used to, then I don't recommend it. But I wouldn't change anything for the world. But the amount of stuff we've learned over these last 5 years, the amount of growth we've had, it's been great. But it's what I know now from what I knew when I started is it's a completely different ballgame.
Now, do you see a lot of competition coming in? Like, do you see DSOs coming in competing with you? What are you saying? Do you see smaller practices bad mouthing you? What's kind of going on? What do you see happening?
Fortunately, I don't see a lot of bad mouthing going on. I don't think one of our key philosophies is to communicate, and we've done that with every employee, whether the ones that are still with us today or the ones that aren't real pleased, didn't like the way things were going and have left us. I think they can all say that they were treated fairly. So I think our reputation has stayed really positive. We haven't really gone out there and tried to push our name and our DSO out there yet. And we have people coming to us. We've turned down more than we've taken on. And
practices to be bought, you're saying?
Right. Correct.
Wow.
And I think it's a testament to who Drew and Wade are and maybe what I've built in my career. And our focus is just doing things the right way, treating people the right way. Our motto is we want to live an empathetic and we want to connect with people. And we truly, I always looked at my entire dental career, whether it was here or at Shine, being the son of a dentist. I mean, my dad has a great practice and it's given us a good life. And, I've always, if it's good enough for my dad, it's good enough for everybody else. And that's the same thing with this. I mean, we want to take care of the dentists that entrust their practices to us. So I want to be a group that, and I want my name and that has had a good name because of my dad and maybe what I've done over the years. We want to continue to grow our brand and do things correctly. And I think people know that that's who we are, and we're not going to sugarcoat it. It's not easy for a doctor to sell to a DSO or to anybody, but whether it's a big DSO or a corporate one. And we go in there and we try to help them have their eyes wide open with how this process is going to go.
Now, when you buy a practice, are you always having the dentist that you buy the practice from come on? Or sometimes are you like, see ya?
Yeah, typically it's an exit strategy. We've had one where the doctor walked away within weeks and was done. And we have one that committed to a year, and we'll see after that. And that's been fine. And we'll bring the associate in to take over. And we've been able to do that. It's been all about, I think what was surprising to me is that, like our first deal with East Memphis, there are a lot of doctors who just don't want to manage it. They just want to do dentistry. And if you'll take all this other stuff off my plate, then I'll do this another 10 years.
I've heard that a lot. Now, when you hire associates, do you have associates who want to go start their own practice and they're not around forever? How do you handle that?
We haven't had that yet, knock on wood. I mean, we want them to be open with us. We're open to possibly, getting into some equity play with the location they're working with. We haven't done that yet. We haven't really needed to. Quite frankly, the doctors are just happy to have patient flow and to do dentistry, the ones we've worked with so far, but we aren't opposed to such things. And if, we obviously have contracts, and if someone wants to leave and it works for both sides and we're honest with each other, then we're okay with that too. I think we've learned to have big confidence in who we are and how we operate. And we're not going to compromise that.
So in summary, it's super hard, but a different type of hard. It's very rewarding if it's the right thing for you.
Right.
And, but if it's not the right thing, it probably would not go well at all. And for you guys, it's allowed you to achieve your goals from a financial perspective, from a kind of a philosophy of life perspective, philosophy of dentistry perspective, without quote unquote selling out. And by doing this, you're helping solve the problem for dentists who are just trying to, get out of the management or get out of the business.
You got it.
So I'm sure there's a lot of people who have already thought about this. Maybe they're not doing it yet. But if someone wanted to reach out to you and pick your brain on this more, how would they get in touch with you?
Oh, they are more than welcome to do that. They can email me. My email address is a lot of long letters with ending vowels. I did not pick the name Bellano, even though with a Gardino Italian last name, you'd think I did. But they can email me at jeff.gardino, Gardino, at BellanoDental.com.
Perfect.
Yep.
So,
one thing I will share, fascinating thing about our staffing is that we, like I said before, we treat people as you'd want to be treated. That's just kind of the golden rule. And we've had such great success hiring staff, front office assistants, hygienists from other DSOs and from other big practices and big groups. And they get to us and they're like, wait a minute, I'm getting paid well. I'm getting the benefits, 401k and health insurance that I was getting at the big group, but you value me. You're giving me a lunch break. You're getting me out of here to normal time. Let's go. And, we don't advertise a lot when we have an opening. Our employees reach out to their friends in the other places. And what's great about folks that come from this bigger practice mentality or another DSO is they're used to working off of goals. They understand what it means to put in the hard work to be successful during the course of a day. Some general practices get that and they're ready to go at it and stretch their mind and grow as their career. But overwhelmingly, I'd say that's been an interesting find for us. It's really worked well.
Yeah, that's absolutely fascinating. But you treat people right, and you treat people, not people like, revenue units or just employees, or just laborers. It's amazing what happens.
Isn't it? It really is.
So, well, Jeff, I really appreciate your time today.
I've enjoyed it so much. Thanks for having me on.
You've been listening to the Financial Flossing Podcast with Ross Brannon.
This has been another episode of Financial Flossing with Ross Brannon, guiding dental professionals to a brighter future. If you liked what you heard, consider subscribing wherever you listen to podcasts. For more on Ross Brannan, visit rossbrannan.com.
Ross Brannan is a registered representative, Coastal Equities, Inc., and investment advisory representative, Coastal Investment Advisors, Inc. Investment advisory services are offered through Coastal Investment Advisors, Inc., and securities are offered through Coastal Equities, Inc. Member FINRA, SIPC, 1201 North Orange Street, Suite 729, Wilmington, Delaware, 19801.